I'm Dr. Nadeem Sajjad Raja. Chronic respiratory diseases or CRDs is an umbrella term of diseases which affect the airways and other structures of the lungs. Some of the most common are chronic obstructive pulmonary disease COPD, asthma, cystic fibrosis, bronchiectasis, lung cancer, sleep apnea, occupational lung diseases, and pulmonary hypertension. In addition to tobacco smoke, other risk factors include air pollution, occupational chemicals, asbestos, and dusts, and frequent lower respiratory tract infections during childhood. Chronic respiratory diseases or CRDs usually develop slowly and may get worse over time. These are not curable. However, various forms of treatment to treat CRDs that help open the air passages and improve shortness of breath can help control symptoms and improve daily life of patients who are living with these diseases. The burden of chronic respiratory diseases that affects both adults as well as children is constantly increasing globally. A report which was published in 2020 by WHO, World Health Organization, indicates an estimate of around 400 million people around the globe are suffering with mild to moderate conditions of asthma and COPD alone. Lower respiratory tract infections caused by Haemophilus influenzae, specifically in children, a death toll ranging between 250,000 and 500,000 deaths every year. In 2015 alone, lower respiratory tract infection caused by Mycobacterium tuberculosis infected 10.4 million worldwide and killed 14% of patients who were infected with Mycobacterium tuberculosis. Other non-infectious conditions like lung cancer caused by tobacco smoking or inhalation of environmental carcinogens were found to kill 1.6 million people yearly, with an alarmed increasing trend. So what are the common signs and symptoms of chronic respiratory diseases? As I mentioned above, or as I said earlier, there are several types of chronic respiratory diseases, but the two most common chronic respiratory diseases are asthma and chronic obstructive pulmonary disease or COPD. These both no doubt affect the airways in the lungs. In asthma, patient suffers by recurrent attacks of shortness of breath and wheezing due to airway narrowing or production of secretions due to infection, which vary in severity and frequency from person to person. Symptoms may occur several times in a day or week in affected individuals. And for some people, these symptoms become worse during physical activity or during nighttime. Asthma is the most common chronic disease among children. In case of emergency, it is very important because some infections or some acute and chronic respiratory diseases can be emergency. So please seek medical help. In asthma, the airway obstruction is reversible with inhaled medicines, but in COPD, it is mostly fixed. COPD only affects adults and usually becomes worse with time. The most common signs and symptoms of COPD are shortness of breath or a need for air, sputum production, and chronic cough. These people are at risk of infections. So what are the common risk factors for asthma and chronic obstructive pulmonary disease? So these include tobacco smoking, including secondhand smoke, which is also called as passive smoking, air pollution, allergens, and occupational risks. Outdoor air pollution and indoor air pollution, often caused by cooking with solid fuels, are also common causes. Asthma and COPD may be prevented by reducing or avoiding exposure to these risk factors. So how COPD can be managed, or asthma? There is no permanent cure of asthma or chronic obstructive pulmonary disease. But several types of treatments are available which can alleviate symptoms, prevent deterioration, and improve daily life of patients who are suffering with asthma or COPD. And after these treatments, patients usually feel better. During attacks of shortness of breath caused by airway narrowing, inhaled medication, for example, bronchodilators open or widen the airways and relieve signs and symptoms of asthma or COPD. If untreated, severe attacks can lead to death. So in case of emergency, please seek help and go to the emergency department. Appropriate management of asthma with inhaled corticosteroid medicines can control the progression of the disease and reduce deaths. So I suggest only use corticosteroids on the advice of the doctor. Long-term treatment is required for people with persistent and exposures which triggers symptoms, for example, smoke, fumes, dust, grass, tree pollen, animal fur, and feathers. These should be avoided. COPD or chronic obstructive pulmonary disease is usually confirmed by a test which is called as spirometry. This test measures how much and how quickly a person can blow air out of their lungs. Symptoms of these diseases can be treated through medical and physical treatments. However, with COPD in people who smoke tobacco and they do not quit smoking, the most effective treatment available is to stop smoking. That is the best management of COPD. This can slow down the progression of the disease of COPD and COPD related deaths. Thank you very much for watching this video.